Hello and welcome to this podcast brought to you by the Isle of Man Anti-Cancer Association. My name is Sandy and I'm the Executive Officer of the Association and a cancer survivor.
And I am Malcolm. I'm a retired consultant surgeon, and throughout my career I had a particular interest in the care and treatment of cancer patients. Presently I am Chairman of the Isle of Man Anti-Cancer Association. In this podcast we want to talk about the importance of seeking professional advice early when you are concerned that things are not quite right and you may have cancer.
Cancer almost certainly starts from a single rogue cell. This cell divides to create 2 cells, each of which subsequently divide to make 4 cells, and so on. In other words, tumours grow in a sort of exponential fashion, quite slowly at first but more rapidly as time goes by. The tumour may well have started and been present in your body for some time, in some cases for years, before it manifests itself and gives rise to symptoms. Such tumours may still be small and may not have spread.
When a patient is diagnosed with a cancer, the doctor will arrange various tests aimed at determining the extent of the disease. One classification used to determine the extent of the disease at the time of diagnosis is by stage. A stage 1 tumour is small and confined to the site where the tumour has arisen. Stage 2 usually means that the tumour is larger, but still hasn't involved any surrounding tissues, although some cancerous cells may have spread to lymph nodes close to the tumour. With stage 3 disease, this usually means the cancer is larger and may have started to spread into surrounding tissues and more lymph nodes have become involved. Stage 4 means that secondaries or metastases are present where spread of the tumour has occurred to other parts of the body, for example, the liver or lung. At present, overall, just over half of tumours are in stage 1 or 2 at presentation, with an ambition from the Cancer Alliance for 3/4 of tumours to be at this stage by 2028.
Detecting a cancerous tumour at the earliest possible stage means that it's smaller, likely to be more localised and therefore easier to remove or treat. Advances in treatments over the years means that even those with widespread disease at the time of diagnosis can survive many years or even decades. However, early presentation will result in less treatment, with less disruption to your normal life and a better chance of being a cancer survivor.
In many of our podcasts on this site, we have focused on the early symptoms of many specific tumours. However, early symptoms can be vague, and there are times when individuals might not be aware that what they are experiencing may be related to an early developing cancer. We all know that if we wake up feeling hot, achy and having a runny nose, that we probably are developing a bout of flu. Such acute illnesses tend to come on quite quickly, over a day or two, and get better almost as quickly, although we may not feel fully back to normal for a week or so.
In general, cancer is a form of chronic disease, with symptoms usually coming on slowly. You may feel not quite right, slightly tired or a bit lethargic, off your food, but still able to go about your normal work and leisure activities. In modern society, most of us lead quite busy lives, and from time to time we feel stressed out and under pressure, often resulting in us feeling tired and losing our appetite for food. We may even lose weight. The early stages of cancer can produce the same symptoms.
A misconception some people have about cancer is that it is painful. Although 1 in 2 of us will develop cancer at some stage in our lives, the majority of us are likely to only develop the disease once in our lifetime. However, at times throughout our lives, most of us will have come across individuals in the late stages of the disease who may be experiencing discomfort or pain requiring medication to control it. So our minds tend to think that this is what the disease is like from the outset. This is not the case. Cancer in its early stages is usually painless. A newly formed painless lump or swelling is more likely to be a cancerous one, whereas, although there are exceptions to every rule, a new painful lesion is usually benign.
Some of us may feel uncomfortable troubling the doctor when we either simply feel slightly out of sorts or have noticed something a bit unusual but not particularly concerning to us. We logically think that there are probably more urgent cases that need to be dealt with. Certainly in these situations we shouldn't be rushing to the GP, but generally most things that are not concerning will settle in just a few weeks. A sensible timescale is that if you're still experiencing the problem 3 weeks after you first noticed it, or that the same issue has recurred after appearing to initially settle, then you should seek professional advice. Getting to see your doctor may be difficult, but an initial telephone appointment or a visit to the practice nurse to discuss your concerns may be all you need to, at least, as a good starting point.
Manx Care has recently indicated that around 450 patients were referred to their service in a single month, with the possibility that they may have cancer. With a figure of around 750 new cancers annually on the island, only 8% or so of those referred actually will have cancer. Such referrals are also increasing year on year by around 11%, with only a small corresponding increase in the actual cases of cancer associated with our ageing population. The incidence of cancer tends to increase with age. This also suggests that cancer awareness in the population is much more heightened than it was in the past, and people are willingly coming forward, although these increased numbers of new referrals are recognised as putting a burden on the health service overall. It must be remembered, however, that early presentation does provide potential savings for the health service, as many of the innovative and effective treatments prescribed for advanced disease can be extremely expensive.
So the message that we are seeking to get across is as follows. You know your own body best. When you recognise that things are not quite right generally, or something new has appeared which has persisted for 3 weeks, or recurred within weeks after appearing to get better, contact your GP or practice nurse about it. Don't just leave it to see if it'll go away. If there is a tumour present, it will continue to grow.
And remember, in most cases, a cancer will not be present. If your doctor or the nurse feels that there is a potential for a tumour developing, they will refer you through the right channels for quick investigations to confirm or, in the vast majority of cases, rule out cancer. A referral through the quick route for investigation for a possible tumour does not mean that you definitely have cancer. The figures suggest that in only 1 in 12 of such referrals will the diagnosis confirm the presence of a cancer. This will provide the potential for you being either diagnosed with an early tumour, with improved outcomes along with less expensive treatment for the health service, or rule out the diagnosis altogether and give you peace of mind that there is nothing serious going on.
If you'd like any further information about cancer, there are many good websites that you can visit. Macmillan, Cancer Research UK, or even the NHS. You can contact the MCIC at Nobles Hospital and phone number 650735, or visit the website cancer.org.im. Also, if you're part of a group, organisation or company and would like to arrange a cancer awareness session, the Isle of Man Anti-Cancer Association can be contacted on 252725, or you can email on iomanticancer@gmail.com. Thank you very much for listening to this podcast.